Hi, everyone. I'd like to welcome you to the first Teams meeting for our Lunch and Learn. We have a really fun fact program coming ahead today, and we are going to be doing this as a monthly series. I'd like to introduce Rosalind Ceasar. She's the Clinical Director of Laurel Helping Hands. She's the city's Youth Services Bureau. She holds a master's in Human Services degree from Regent University, Virginia, and a certificate in Advanced Studies Counseling Psychology from Loyola College in Baltimore, which is now called Loyola University. Rosalind is a licensed clinical professional counselor and a board-approved clinical supervisor in Maryland. She is also a national certified counselor. And joining her is her intern this summer, Amanda Siebold. She is an intern at Laurel Helping Hands. She's pursuing her master's in social work from Catholic University. After graduating from Mount St. Mary's University with a bachelor's degree in English, she taught high school for 2 years in Montgomery County Public School System. It was in those 2 years that she saw the great need for mental health support for young people. She realized her passion was to counsel young people and help them and their families work towards healing. So I'd like to, after introducing the panelists, they're going to start a conversation about the impact of COVID-19. Thank you, ladies.
Hi, so I am Rosalind, and I am the Clinical Director for the Youth Services Bureau. So today we are going to have a conversation about the impact of COVID-19. We have all been impacted by COVID on one level or the other, even if not directly, indirectly, but definitely we have all been impacted. And so today we want to have a conversation where we open out some issues that we may all be aware of but have not thought deeply about. We want to consider them from different aspects, to look at some things we can do to minimize its impact on ourselves. There is a questions and answers option, an option to put in questions, and James will probably talk about it a little bit more, but we wanted you to start putting any questions that you have down, so that if it is something we are already addressing or it's something that is a part of what we are addressing, we can fit it in smoothly so we don't have to wait till the end for you to ask your questions. So if you have any questions, please go ahead and ask them. The other thing we wanted you to think about as we are going through this, we're going to offer a lot of resources. It can feel a little overwhelming, and we just want you to know that these are not things we expect you to take, sit down, and in 30 minutes figure them out. Some of them take a couple of tries, a couple of days, a couple of weeks for you to be able to get something that works. So we just want you to take the information, and then when you get to sitting down to working on it, give yourself time, pace yourself, and don't get overwhelmed. If you have any questions, feel free to reach out to us and ask us, and we will support you. And then the other thing we want you to keep in mind is that as we talk about this, we are not only talking about you, we are talking about all of us coming back into the workplace. Keeping these things in mind as we come in to interact will help us to have better interactions, because everybody is stressed, everybody has been impacted. So even if it is something that's not applying to you, it may be applying to somebody, and so it's useful to keep it in mind. Okay, so thank you very much, and I'm going to hand over to Amanda. She's going to start us off.
Okay, yeah, so as Rosalind talked about, this pandemic has been affecting all of us in different ways. So James, you can go ahead to the next slide. So we're going to start by talking about why this pandemic has been so difficult and things that we can do. We're going to give you some practical tools to mediate some of the effects. So firstly, obviously this came out of nowhere, right? And there has been a lot of unknown with this. And these are things that cause anxiety in general. Feeling helpless, not having a lot of control, the fear of the unknown. So that's why a lot of things have been coming up for people. I heard a psychologist say that humans are able to endure a lot of suffering if there is a definite ending, but this has had an indefinite ending, so it feels a bit infinite, right? We just don't know when things are going to end. I remember when it first started thinking that I would have never expected in September we would still be in this situation. So there's just a lot of unknowns. So 2 things that we can do in order to mediate some of these effects. The first thing is creating a daily schedule and sticking to it. And so I'm going to show you an example template of how to create a schedule. The other thing is having a plan. So if you get sick, lose your job, have to quarantine, what's important here is to prepare so that you can avoid feeling overwhelmed later down the line when something comes at you. So go to the next slide. We're going to look at a sample schedule. Okay, so this is something that is in Excel and you will have for your the ability to edit yourselves. So this is, again, just a template. You can create whatever, if you have a different format you'd like to use. But we created this in Excel. What's nice about this is that you can just copy and paste different events into different slots really easily. So you can see that you have even like what time you're going to wake up, create factoring time for exercise, eating breakfast, eating lunch, and then of course, blocking out time for work and creating breaks between your work schedules, especially if you're working from home and you maybe have to check on your kids, whatever that is. And then even putting in time to go to bed so that you get a solid night's sleep, because that's really important. So with this schedule, as Rosalind was talking about, give yourself some time to get used to this. It might take you a month to find a schedule that works for you. So it's kind of a tricky balance between accountability, right? So creating a schedule and sticking to it, but then also being flexible because things come up and can wreck your schedule for the entire day. So being gentle on yourself and then just getting back up and, reworking your schedule to something that works better for you. So this is going to take time. So the next resource we have for you is for creating a plan. So I'm not going to go over this in detail, but this first slide and then the next slide go over how to solve a problem. So defining your problem, brainstorming solutions, and then generating possible obstacles, right? So again, like losing your job or someone gets sick, what kinds of things might be throwing you off of your planning. So again, you're less likely to get overwhelmed down the road if you have a plan. And it's important to create a plan and be prepared for when unexpected circumstances arise. So the next slide, talking about trauma and secondary trauma and re-traumatization. So the first point is we've all been exposed to trauma in some way during this pandemic. Okay, so trauma just in general, right? It's a distressing experience and it's how we handle our response to that distressing experience. So some of us have had actual trauma happen throughout this pandemic, whether you've lost a loved one or you've lost a job. But then there's also secondary trauma, which is essentially indirect exposure to a traumatic event through someone's retelling of the event, or even something like the news, right? So if you're watching a lot of news, you could be experiencing the effects of secondary trauma. And then re-traumatization is when you're re-experiencing trauma and you're reminded of it. So you might have had a traumatic event early at the at the beginning of the pandemic, and then re-traumatization is when you're sort of re-feeling those feelings of panic and anxiety. So what can you do? Firstly, minimizing your exposure. So obviously there's things that are out of our control. We cannot just prevent a traumatic event from happening. But as far as the secondary trauma and re-traumatization, avoiding watching a ton of news, which we'll go over in the next slide. So determine what, when, and where you get your information. Okay, so now going more specifically into watching the news. So we're not saying that you shouldn't be watching the news, but how can we kind of manage it to not feel some of those effects of trauma? So right now we've obviously seen there's polarized information and it has 2 effects. So it can create confusion, it adds to the uncertainty, and it feels like we are out of control because there's just these 2 spectrums of information coming at us. And it's also creating additional social stress, right? So there's people who might totally disagree with you, and this is going to come into play when we're coming back to work with each other. And therefore it's going to create some social stress, some tension between relationships. So what can you do? First, identify 2 to 3 reliable sources and stick with them. So if you have one news outlet, you should, have a couple different things that you can reference, and then just stick with them and minimize your exposure. So I would recommend not, as soon as you wake up, turning on the news. That's probably not the best thing, because you're going to start off your day thinking about all of the panic, all the things that are going on in the world, right? So I always recommend self-care in the beginning of the morning, and we'll talk about that a little bit later. And then respecting people's choices, right? You cannot control anyone but yourself, and I know it can be difficult, especially when they are on a totally different viewpoint than you, but just recognizing that we're all being kind of fed different information. So then the next slide, some more things that we can do. Okay, so we've all had different experiences, significant others, our family. We've all had different experiences with this pandemic regarding health, employment, finances, lifestyle, and our future. A lot of it's unknown. So some other things that we can do firstly is maintaining boundaries. So maintaining boundaries means you need to have some self-awareness. So knowing how people affect you, and it's totally okay, and you really should have boundaries in your relationships. So something that looks like is if someone is coming to you and saying, hey, I really need to talk about how this is stressing me out, and you're having difficulty yourself, you just have to respectfully state where you're at and that you can't help them at that time. So that can look like saying, hey, I can tell you're upset right now and I'd like to help you. I have to go to bed right now. I have to take care of myself, whatever that is. So just showing that you care and you're being respectful to the relationships in your life, but just, taking care of yourself. Reconstruct a new normal. So you've probably started to feel some of this at this point, but habituation does occur. So things start to become comfortable, and then you no longer notice that as this is our new normal, right? So some of the things are going to start to feel more comfortable as we progress through this. And then just remember to accept things that are out of your control. And then finally, retooling for the future. So a lot of us have had to get used to technology. I think that's probably the biggest thing. We're all learning these new skills with this new work environment. So these are things that we can take into the future. So viewing it in that perspective is a lot more hopeful. So the next part of this presentation, Rosalind's going to go more specifically into the mental health aspects of the pandemic.
Okay. So like I said earlier on, we have not all been affected in the same way. So not everybody may have gotten sick, had somebody in their family get sick, lost a job, lost finances, but we have all been affected by the uncertainty and by just the general sense of lack of safety. Even if you don't believe in COVID, even if you didn't believe the theory, just the general uncertainty associated with everybody else who believes it and is dealing with it has impacted all of us. So I think that mental health is the one area where universally we have all been affected. And the research is showing us that there are two main areas where this is happening, in the area of how people's levels of depression and people's levels of anxiety. And we wanted to break down these things a little bit because we tend to not necessarily notice them. Okay, so when we are talking about depression, you want to think, the two main things you want to think when it comes to depression is feelings of helplessness and feelings of hopelessness. So if you're thinking more of, I can't do this, I can't do this, I can't do this, you're starting to feel helpless. I can't do anything about this. When we are helpless, it doesn't necessarily mean it cannot be done, which is hopelessness. It means that I can't do it. Something can be done, other people can do it, but I cannot do it. Feelings of hopelessness says that nothing can be done. So this pandemic, nobody's going to find a vaccine and then I will be dead. We are not going to be able to get out of our house again. That's hopelessness. You feel like your options have run out. Anxiety is the constant worry that something is going to go wrong, something bad is going to happen. And we put there, recognize the difference between thinking or planning and worrying, because we may think that if I'm running the thoughts through my head over and over again, I am thinking. There's a distinct difference between the two. When you're thinking or planning, you tend to be solution focused. I am trying to get this done. So how do I need to get it done? If I go in the office, I'll have to open doors. Somebody who has COVID may have opened a door. So how do I prevent myself from catching it if I open the door after the person? You're looking for a solution. Once you find your solution, you move on. And if you don't have a solution, you keep running it through your mind. You have a solution, you move on. When it comes to worrying, the focus is not really the solution. The focus is all the things that are going to go wrong. And so somebody is going to open a door and they may have COVID, and then I may get sick, and then my children are going to get sick, and then I have to be quarantined, and then I'm going to lose my job. It doesn't focus so much on how do I actually solve this. And so let's pay attention so that when we catch ourselves, we can distinguish between whether we are thinking and planning about something, like we mentioned before, problem solving, or we are just worried. And then the other thing that we want to pay attention to, there is a strong connection between anger and anxiety, because the biological responses to anger and anxiety are pretty much the same. The same hormones are triggered when we are angry or when we are anxious, and so we tend to have the same response. So many times when people are anxious, what we see in their behavior is actually anger. And to give you an example, think of somebody who is worried that they are going to get sick, and then you come into the office and you start talking about somebody who got sick. They just explode, and it's like out of nowhere they exploded, and you don't understand why. They are probably anxious already, and you hitting on that thing is triggering that anxiety, and their only response to tampering that anxiety is to remove it. And that is what we do. When we feel threatened, because anxiety is a level of feeling of threat. When I feel threatened, I lash out, I fight. That is the biological response, and anger is that fight part. So that is something to keep in mind as we come back to work, that if we see people responding with anger to situations that we may consider benign, and we don't think it's a big deal, that may be some of what is going on, even if it's not happening to us. So that as we interact with people, we should be sensitive to these things. Okay, we can go to the next slide. So this is a simple screening for depression that we put together. So everyone experiences some of these symptoms and signs at different times. We feel them. There are times when we feel sad. There are times when we feel helpless because a new situation has arisen and we haven't been able to think of anything yet. We get concerned when somebody is experiencing a lot of these symptoms and they are consistently happening and they are intense so that they are disrupting their lives. This is not for you to diagnose yourself. What we want you to do is take a look at these things, and if you feel like you are experiencing a lot of these feelings, and they are getting worse and they are taking time and they are not diminishing, we want you to consider talking to a professional, a counselor, a primary care physician. Talk to somebody who will know how to guide you, because you may be experiencing signs of depression. The next slide, please. Then the other one is for anxiety. It's the same thing. Look at these signs. Look at your life in the last 2 weeks. Are you experiencing these symptoms, and are they disrupting your life, making it difficult to manage? And are they getting worse? Okay, because we all experience them to some degree over time, but they are not disruptive and they tend to diminish. Okay, next slide, please. Okay, so again, talking about depression and anxiety, you may think, oh, I don't think this is going on. Again, not every level is going to be clinical so that you require treatment, but being conscious means that you can be proactive and take steps so that it doesn't impact you in other ways. Because let's take, for instance, something like depression. Depressed people tend to do less than they would normally do, And so if, for instance, you are a parent and you start feeling depressed, chances are you will not engage with your child as much. So in this time when kids have to do virtual learning and they're going to need their parents to be very present, if you are starting to feel this way, it's important to be aware so that you can step in and intercept it. Otherwise, over time, the effect is going to go from you to the kid and it's going to show up in their schoolwork. So we want to catch these things. But to give you an idea of what has been happening, this is research done, data put together by the National Health Council, and showing the impact of COVID on mental health. And this is since January, and these surveys were done, I think, between January and March or January and April. There's a 300% increase in just people who are expressing symptoms of anxiety when they show up for just regular checkups and they're screened for anxiety. And that translates into about 34,000 more people having anxiety since COVID began. Depression is almost 400% more since COVID began. So these, if you think about it in that way, it means that these are people who normally wouldn't have been depressed, wouldn't have been anxious, but they are starting to show these signs. And for 84,000, these are the number of people that they project, just giving the data that these are 84,000 more people than normal who will show these symptoms of, who will have depression and anxiety in this period versus the previous year, or just versus the last couple of months before COVID started. Okay. People have gotten to the point of hopelessness. Suicide has increased. And in May, 1 out of 4 people were mentioning grief and loss or just financial issues. Those were the 2 common themes that were coming up when they were screening people: concern about grief and loss, concern about financial issues. And loss has to do with just people's sense of their future, people they have actually loved, their health, finances. So all these things come into play and they're impacting us on various levels. Okay, so we want to be conscious so we can act on it. Next slide, please. So special populations for us to keep in mind as we come into the workplace, and as parents, as family members. These are populations that tend to experience these symptoms already at a higher level than the general population. And so we want to keep them in mind and pay attention to them. LGBTQ caregivers, if you're a caregiver for another person, especially an older person, it's already stressful. Corona has made it even more stressful. You want to be aware that you are under extra stress. For students, for veterans, and people with pre-existing conditions, because they worry about how that interacts with COVID. Then this is something that I personally did not know. I expected that they would have an increase, but I was surprised to find that it said teens and young adults, 80% increase in anxiety, 90% increase in depression when they were screened. Just in May, they were showing the highest rates of anxiety and depression. The general population was about anywhere from 25 to 40%. This group, teens and young adults, is 80 to 90. And it is possible that they don't have as much control over their world, especially for teens. They tend to take their cues from the adults. So if the adults are stressing out, it means that it's stressful. So that is something for us to keep in mind as parents, that our children take their cues from us. If we get stressed out, they're going to get more stressed out because they don't understand what we're doing as well. Okay, they don't have as much control. Next slide, please. Okay, so are you overwhelmed? You may not necessarily be depressed. You may not necessarily be at clinical level anxiety, but if we are starting to see these symptoms or these signs, it may be a sign that we are overwhelmed. And when we go to the next slide that talks about self-care, it means that it's important that we pay attention to our self-care. Okay, you're generally not feeling well. You wake up and you don't feel well. you have more aches than normal, more pains, you're getting infections, you're tired all the time, you're having trouble sleeping, difficulty concentration, increased irritability. So, and let me go back, with increased irritability, one of the things we know with teenagers and children is that when they are depressed, we don't tend to see sadness like we're all used to. We're all used to saying, oh, the person is depressed, they're sad. With teenagers, irritability is usually the thing that you see. So you see anger, you see them becoming belligerent, you see them just refusing to comply with the things they used to comply with. They're just difficult. When you see a lot of those behaviors in teenagers, you're probably looking at a child who may be experiencing depression. So that is something to keep in mind. Then there has been an increase. All the reports tell, research says that there's been an increase in problematic coping behaviors. So people are drinking more. And I think we all saw the TV news items of people queuing outside the liquor store, buying cartons and cartons and bottles of alcohol. And for some reason, people felt that they needed that. But there has been an increase. There's been an increase in gambling. And I was listening to the news the other day, and they're talking about people are actually even doing investments, which we normally think of as good things. And they're investing like it's a gamble. They are investing like it's a game. There has been an increase in domestic violence. So these are things that their effects tend to snowball very quickly. And so we want to say that if anybody is experiencing behaviors in this area, so please be very conscious and reach out for help, because these behaviors tend to be addictive and get out of control very quickly before you realize them. So to pay attention to them. Then if you have a desire, if you feel you wake up one morning, it's like, I wish I could just leave. Okay. Or right now I can't do anything. I can't do it. I am unable to do anything. We want you to pay attention. Those are things that we want you to flag and say that I need to probably talk to somebody. Okay. So taking all these into account, we now want to look at, if all this is going on with me, how do I take care of myself? If it is not clinical level so that I need to talk to a counselor, a physician, what can I do? Okay, so Amanda will take that.
Yeah, so as we've seen, there's clearly a greater need for us to take care of ourselves right now. And so self-care is a great preventative measure too. It's something that you can use if you're not feeling super stressed, just as a daily routine to kind of manage some of those symptoms. So the first thing we recommend is taking care of your body. So self-care is not, it's not selfish, and you'll see a lot of these things include other people. It's not just a solo activity. So it's really a whole holistic approach to taking care of ourselves. So the first thing is our body, right? So using activities that induce relaxation and reduce our stress. So things like deep breathing, meditation, and mindfulness. And we're going to look at some of these strategies after this slide, some actual practical tools that you can do. Second thing, eat healthy. So this actually makes a big difference when you are feeding your body well. What you're putting in comes out. So just being more aware of trying to do little things to eat healthier. That does not mean radically changing your entire diet. Exercising regularly, so moving your body. Again, you don't need to be an athlete to practice self-care. If you're getting out on walks, getting outside, those are really big, important things. Getting plenty of sleep. You will notice if you're not sleeping as well, you're not getting enough sleep, that affects the next day and how you're acting, your behaviors. You're more irritable, it's harder to focus on your work. Getting plenty of sleep is a big part of that. Next, as Rosalind mentioned, avoid indulging in behaviors that can become addictive. So alcohol, drug use, pornography, gambling, you know yourself. So just being aware of things that you might fall into, old habits can arise. So just avoiding those is a better practice. And then finally, make time to unwind. So do things that you enjoy, whether that's playing an instrument or having a particular hobby. If you're a crafter or something like that, if you like to create, you want to try to do some of these activities, especially since we have a little bit we have a different schedule. We're not always commuting, so you have a little bit more time to do that. So the next slide, we're going to look at different mindfulness activities, different ways to calm our bodies. So the first one is called the feeling exercise. We have the seeing game. So these are different things that we can do for our kids, but also for ourselves. So if our kids can do it, we can totally do them too. And it's something that you could do with your kids or with other people, with family. We can go ahead and scroll through some of these, and then I'll take you through one specifically. So the feeling exercise, you're just gathering things. The seeing game, you are looking around at things and making notice of your surroundings. Mindfulness sort of slows down your thoughts and causes you to focus on the present, what's around you. The next one, we have ocean breathing, and that is one I'm going to come back to, and we're going to practice together. The power of listening is the next one. Again, you can see that the sensory, that we're focusing on the senses. So just focusing on sounds that you hear. So that requires you to stop and pause and calm your body and listen. The next slide, one option is to build a stress ball. So this could be something fun to do with your kids. And then the next one I like because it is a more physical activity. So if you have very active kids, this would be a great activity for you. But it's called the body squeezing exercises. So you can see, and again, you'll have access to this information that you can look at. If this is, to see what works for you, these might not all work for you, right? That you want to pick one that you really enjoy. It shouldn't be unpleasant for you. It should be a pleasant experience. The body squeezing exercise, you're physically engaging with your body. So curling your toes, making fists, all of these things, again, require you to slow down and make note of your surroundings and getting in tune with your body. And then the last one, the 5 senses exercise. So this requires you to go outside and making note of the different 5 senses. So you can take your kids through each of them. What kinds of things do you see? What do you hear? What do you smell? What do you feel? And having them describe those textures is really cool. So I'm going to go back 2 slides. The one that says ocean breathing. Yes, that one. So this is one that is great. I think everyone should know how to deep breathe essentially, and it's fun because it's called ocean breathing. So you get the kids involved, and it's easier for them to think about, oh, what does the ocean sound like? So you're going to sit or lie down in a comfortable position. So if you're sitting, I just recommend like sitting up straight, and you're going to slowly breathe in through your nose. And then you're going to breathe out through pursed lips, right? So you just kind of like purse your lips like that, as if you're blowing through a straw. So the point of this is that it will sound like the ocean. You breathe in slowly, and then breathe out, it would sound like the ocean waves. And so when you're practicing this, you want to teach the kids to slow down their breathing, because I think the ultimate, and even for us as adults, we just aren't used to slowing down our breathing. I always recommend you holding your belly. So you want to breathe in through your belly and create like a balloon, like you're blowing up a balloon in your belly. Because if you're breathing up here, it can still be stressful. So this kind of reminds me of when you're really stressed and you're, what's the word?
Hyperventilating.
Yes, hyperventilating. Thank you. Yeah. So that's kind of what it reminds me of, right? So you want to breathe through your belly, like you're creating a balloon, breathing in, and then your belly should go out. And then slowly breathing out as well. We don't want to take this really nice breath in and then just, okay, because that's not going to help with the relaxation either. So slowing in and then slowly out. And then you want to do that for 1 to 2 minutes. And that's something that you can do when maybe you're feeling or your kids are feeling a little bit escalated. Maybe they're a little stressed. You just take this little pause and you say, oh, let's do some breathing. Let's do some breathing. And you can say that to yourself. Remind yourself, oh, okay, I'm going to do some breathing. Okay, so that's a great way to kind of immediately feel calm. And we'll see this like with clients. I had a client who just said, like, I feel calm in my body. So it kind of works throughout the whole body. So then moving on to a few slides down, the next slide we haven't looked at, Connecting with others, yes. So another thing that we can do for self-care is connecting. As I said, this is not just a solo activity. So talk with people you trust about your concerns and how you're feeling. You know your friends, you know your family, so you know who's going to be a great person to talk to. The people that are going to listen, who are going to validate your feelings, and then there are other people who can kind of suck the energy out of you, so you want to make sure that that's not who you're constantly going to. Connecting with your community. So we have a lot of resources right now as far as online, Zoom meetings, so you can connect through social media, by phone, or with your church, whatever faith-based organizations you have. And then finally, as Rosalind mentioned, seeking help, right? So if you're noticing that, oh, I am really struggling and I've been struggling for a while, this has been really difficult for me, you want to seek help from a professional counselor, social worker, psychologist, psychiatrist, whoever it is. And where you can start for that, if you're not really sure where to find a good therapist, you can go to obviously your primary care, and they could recommend, they can also help you, and then go through your insurance and see maybe where they might recommend. And then also just talking to your friends and your family who have seen a therapist, who someone that they recommend, so that you feel like you have someone who's safe for you. And then now that we've kind of talked about self-care, some little things that we can do to manage our symptoms, prevent them, from more of a bigger scale, Rosalind's going to talk about this crisis and how there are some opportunities from it.
Okay. So if we go to the next slide, so we have all talked about the COVID crisis, and that's how it has been described, and that's how it's been framed in our minds. But a crisis is, as I said, it's a perception of an event or a situation as intolerable difficulty that exceeds our ability to cope. Okay, it has the ability to disrupt our lives. It affects how we think, how we feel, we act, and COVID has covered all those things. But what we wanted to bring out today was that a crisis holds two things: danger as well as opportunity. And COVID has been framed by and large as a danger, but there's actually been opportunity in it for some people or for some situations. And so we want to look at how we are framing our experience during this period, because the way we frame an experience sometimes is more important than the experience itself. Because if we frame it positively, it becomes a great experience. If we frame it negatively, then it's awful. And so we want to look at how we are framing this situation. Has it been a danger for us? Has it been an opportunity for us? So let's go to the next slide, please. Okay. So what we have to keep in mind, and this is something that's going to be important as we come back, not everybody experiences a crisis. Again, we said a crisis is a situation that has the capacity to overwhelm us. But not everybody experiences a crisis as a negative event. They acknowledge that it was overwhelming, they didn't think they could make it, but they don't experience it as negative. Think of it as the people the thrill seekers. When they jump off that cliff, everybody's like, oh my God, he's gonna die. And they're like, it was wonderful. That is the difference. So somebody experiences that as a crisis, they're going to die, this is the end of them, and somebody thinks, oh, it was the greatest experience. So a crisis is not always experienced as negative by everyone. We have to keep that in mind as we talk to people, so that we don't have the social tension we were talking about. Research says that actually up to about 75% of people who go through a traumatic experience, they experience it as negative, but they move on. It doesn't have negative effects. They don't experience post-traumatic stress. It was just a bad experience. They recognize it as such and they frame it. So what we want to do today is to look at this situation and start framing it not in an all or nothing way, it's either black or white, but to start looking at the grays. Okay, because if we really look, we may have had some really bad blacks, some really good whites, and a whole lot of grays in between. Okay, so and then another thing we wanted to bring out as we go through this, you may, when we have a worksheet after this, you may find that you have actually had no negative experiences at all in this period. What we know is that people tend to feel guilty that they have not had a bad experience in a bad situation. And I'm sure we've heard the stories about like soldiers come back from war and they feel guilty that they didn't die, or there was a disaster and the people who survived feel guilty that they were not the one, they were the ones who survived. We want to be aware that if we have had a positive experience during this period, it is okay to acknowledge it as positive. We don't have to play down our experiences just because it makes other people feel better. We have to be empathetic to other people's experiences if it has been negative, but we should be conscious that this exists so that we don't carry guilt that is unmerited. To the next slide. So one thing that we thought it would be great for us to do is to take, this is just a sample. Again, this is on Excel, so you can add different areas because different people have had different impacts. Is look at, has this been a danger in this area? So we listed some areas. In terms of your productivity, has it been a danger? Has it taken away from your productivity? Or has it been an opportunity? Have you actually been more productive? And research is shows that actually when people work from home, they tend to be more productive. So you may actually have been more productive in this period. In terms of schedule changes, like Amanda mentioned, if you are not commuting, you may actually have earned more time that you're using to do other things, to sleep in more, to exercise more. So you may actually have had some opportunities. So we put in an example. In terms for marriage, you may be spending more time with your spouse, but now you have more time to argue as well. So some things may have both danger and opportunity. What we want you to do is to do these things, but also to think we are not just adding up the opportunities and the dangers so that I have 10 dangers and so my life has been horrible and only 3 opportunities. Some things carry more weight than others. So if it has impacted your child's schooling, on the other hand, you're spending more time with them, so you actually know more about what's going on in their lives, and that carries more weight for you. So even though there have been negatives, there have actually been positives, and those are the things we want to be conscious of. When Amanda talked about retooling, the versatility is about opportunities, because this COVID period has actually been a huge opportunity for those who were prepared to go into virtual communication platforms. So Zoom and GoToMeeting and Teams are having the time of their lives because they were positioned for those. So for them, this experience as a business may have been totally positive. So we want to consider all those things because versatility means that we are able to take advantage of the opportunities in a crisis to move forward. Okay. So those are the things we want to keep in mind as we do this. We don't want to frame the whole period as a horrible, terrible experience. We want to keep in mind that it has had both. And so to look at the good with the negative. Okay. So we come to your turn. We have talked a lot. This is your chance to ask your questions, share your thoughts, make comments, anything you want to talk about. I will hand over to Pat here.
I know. Can't hear nothing.
So one question that comes to mind, going back to talking about the self-care activities, think in terms of when you are aroused, when your body is aroused, these are activities to help you to calm, to reduce the arousal or turn it in the other direction. So when you're breathing, when you are looking at the sights, what it's allowing you to do is to reduce arousal so that you can engage your brain. When we are anxious, when we are angry, when we are upset, we tend to respond emotionally. When we do these exercises, they tend to reduce the level of emotion so that they allow us to engage the thinking portion of our brain. And when we're working with kids, we tell them, think the back of your head and the front of your head. When you're angry or you're upset, the back of your head is working. You want to bring it to the front of your head where your thinking processes are. When we are breathing and we are looking at these sites around us, what it's doing is removing activity from the back of our heads so that the front of our heads can engage. And so anything you can do to reduce your focus on your emotions and get you to think, it's going to be helpful. Okay.
So Rosalind, we are having some technical difficulties with getting people connected to the meeting. We've had between 10 and 20 people join and several emails from people who have been unable to join. So if you have any questions that you think people might have,
Okay.
I don't know that we're going to get very much in the way of direct question and answer.
Okay. So one thing that going back to the screenings, one thing that people tend to, am I depressed? Am I anxious? How do I figure out that this is serious enough to see somebody? Think intensity, frequency, and duration. How intense is this feeling of sadness? Or how intense is this feeling of lack of interest? Or how intense is this level of anxiety? If the intensity is getting worse over time, you are getting worse. If it's happening, if the frequency is increasing, oh, I used to panic once a month when my bills came. Now I'm panicking every week. It is more frequent.
That's what I want you to look at.
So there's increased frequency. It means that you are getting worse. Then duration. I used to panic once a month. It will take me all of 5 minutes, and then I will say, okay, come on, get it together. Your paycheck is going to come next week. You're going to be fine. Now I am panicking, and it's 2 hours of panic, and I can't calm down. Things are getting worse. And so whenever you look at behaviors, you're trying to decide whether a behavior is a problem. You want to think, is it increasing in intensity? Is it increasing in frequency? And is it increasing in the duration in which I'm experiencing this? Okay.
Rosalind,
Yes.
would you be willing to accept questions by email since so many people have not had connectability?
Yes, that is fine. So our email is on the last slide. So yes, so you can email questions to lhh@laurel.md.us, and we will respond to you. Feel free to reach out to us with any questions about this presentation or any other question related to mental behavioral health, parenting, and we will hook you up with the necessary information. Okay. We have a presentation coming up next month for parents. And it's for parents, but really this is even relevant for just working from home. Just looking at things that parents can do to help kids as school starts. By the time we do this, we would all have had like a month's worth of experience with our kids. So we'll probably have questions. So if you have questions, you can actually send them ahead to us ahead of time, so that if we need to reach out to the school system to find answers, we can do that before and include it in our presentation.
Well, thank you, everyone. This was a great presentation. I'm looking forward to the next one. James, if we can meet and figure out what's gone wrong, so we can correct it. And we are going to play this again tomorrow. Is that what you had said, James?
Yes, we've made the recording. It'll be available once it's encoded after this, and we'll be sending that out tomorrow. And Laurel TV is planning on broadcasting it tomorrow as well.
That's wonderful. That's wonderful news. Well, thank you, everyone, and send your questions in. And I look forward to having this again next month. Thank you.
Thank you.